I want to welcome our viewers and listeners today as we provide resources in your decision and planning for surgery for those of you affected by breast cancer. Solutions often begin with a conversation. When faced with the task of planning your surgery, it is our goal to provide a pathway to workable solutions. My guest today is Dr. Andrew Elkwood. He is an international expert in advanced reconstruction and a highly skilled microsurgeon. Dr. Elkwood is the founder of the Plastic Surgery Center and IFAR, the Institute for Advanced Reconstruction in New Jersey. He will be visiting the Vanguard Plastic Surgery practice in Fort Lauderdale, Florida, PRMA, Plastic Reconstructive Microsurgical Associates in San Antonio, and the Center for Restorative Breast Surgery in New Orleans, Louisiana this summer. He will be on site there, and in the descriptions for your reference, we will put the website that you can also visit, which is www.advancedreconstruction.com, or you can call 954-218-5137 at any time to schedule a consultation with a surgeon on these advanced specialty conditions. So, Dr. Elkwood, I'm very pleased to have you today. Welcome to the podcast and the YouTube channel. We're going to repurpose this for both. So I'm very happy to have you today. Welcome.
Well, thank you. Happy to be here.
So besides performing breast reconstruction, surgery like deep flap breast reconstruction, your surgeons perform surgery to address nerve-related conditions that arise due to breast cancer treatment. So can you please give us a description of some of these treatments and conditions that you handle, Dr. Elkwood?
Sure. They're not all nerve-related, but related to the secondary issues from the breast cancer treatment.
Correct.
Many of which are nerve-related.
Mm-hmm.
Fortunately, we've made great strides as a medical community in curing breast cancer and limiting some of the secondary deformities and so on that go along with breast cancer, but yet there are still many. Obviously, a woman with an unreconstructed breast is the most obvious deformity or issue after the treatment of breast cancer, but there are others that are less known but very, very troublesome. Some of them include neuropathy and post-chemotherapy neuropathy. Some of the stronger chemotherapy agents can leave people with some nerve damage. That in many instances can be treated. Post-mastectomy pain. Every inch of the body has sensibility of feeling, and the breast is obviously no different. And post-mastectomy, those fine nerves that go to the skin need to be cut, just as nature of surgery, particularly removing the breast. And sometimes they can grow back in a very painful way. And that can be very troublesome for women. And that's another thing that we treat. Lymphedema, or swelling of the arm, can be a real problem for women. And depending upon the statistics that you look at, it is relatively prevalent. Now with a sentinel lymph node dissection, taking less lymph nodes from the axilla or the armpit, it helps limit it somewhat, but that procedure sometimes can leave people with lymphedema. Mm-hmm. As well as the women that need, full axillary dissection or full lymph node dissection in their armpit. They could very well be left with lymphedema. And we do surgery to help treat that. Radiation-induced brachial plexopathy, which is a mouthful. Radiation can be wonderful. It can cure people of cancer. Nerves often don't like radiation. And it can cause scarring of the nerves even years later. Women that particularly have had what we call an axillary boost, additional radiation to their armpit, if they had positive lymph nodes and so on, or advanced cancers, can get secondary pain, numbness, and paralysis of their arm. And that is something we can help to treat. It's a difficult problem to treat. We can help to treat it. It can very well occur years later, just based upon the mechanism that the radiation causes. And those are, the typical additional procedures or additional disease states surrounding breast cancer that we treat.
What about, I hear women sometimes have concerns about hernia.
Well, hernia after autologous breast reconstruction
Correct. That's what I'm
is
talking
another
about.
thing.
Thank you.
Right. That is another thing that can happen.
Mm-hmm.
And it depends on a lot of things. Some people are more predisposed just based upon their tissue, based upon their body habits, how much they weigh, things like that.
Mm-hmm.
Some of the modern techniques in doing the breast reconstruction help to limit, but they certainly don't negate it.
Mm-hmm.
That is something else that we deal with as well, is some of these more complex hernias. And there's also a notion of pseudo hernia. So it's a technical difference that, a hernia is where the intestines really poke through a weakness in the abdominal wall.
Mm-hmm.
And that has a danger to it in that the intestines can get strangulated. But a pseudo hernia or a bulge is where the intestines don't actually poke through, so it's not as dangerous.
Mm-hmm.
But there's a laxity or big bulge of the abdominal wall that can be troublesome, annoying, unsightly, and so on. And those are things that we deal with as well.
Okay, well, I'm very glad that you went over these other effects that are sometimes precipitated or happen because of breast cancer treatment, whether chemotherapy or surgery. I hear a lot of these conditions. I don't want to say a lot, but I hear enough that I'm very, very pleased that we had this chat today, and for you spending time with providing these resources for the community that we really both serve, Dr. Elkwood. So, but more importantly, you have provided access. That's the key here, is providing access, I think, in treatment and care for patients to reach out to you. We'll have some more information in the notes and description for them to get a hold of you. And so please remember to check the end credits and also the links and information, like I said, that I will have in the description. Is there anything else that you would like to add today, Dr. Elkwood?
Yeah, well, a couple of things.
Yeah.
Firstly, the women that are affected by these secondary issues shouldn't feel that anything was done wrong, or there were other alternatives that could have prevented it. And sometimes that is the case, but most of the time it's not. It's just kind of a bad roll of the dice. Obviously, women that have more advanced disease are more likely to get some of these issues. Some of it also has to do with just body habitus. Some of the things, the thinner you are, makes it a little more difficult. And some of the things, frankly, the chunkier you are, makes it a little more difficult. So body habitus is one, and advanced stage of the disease is another. But the women shouldn't feel that anything went wrong particularly. These are just known issues that can occur with breast cancer treatment. And the other thing is, our surgical group is one of very few that deals with some of these issues. That surgery we typically do in New Jersey, not exclusively so, but typically. And in the past, we've had patients reach out to us, or still presently, and we do telemedicine consults, and we have a whole team that helps to evaluate these patients from a distance and get their histories together, and so that the doctors can have a meaningful telemedicine visit, and then bring the patients in either for further evaluation or for surgery. One of the things we're trying to do now is, with our sister practices around the country, actually see patients in those spots. We think it would be more convenient for the patient, more accurate, and more convenient when it comes as compared to telemedicine. So that we kind of call it telemedicine at a distance. That we can do initial consultations with the patients, and if need be, bring them back to the institutions of expertise where we perform the surgery, but help with outreach that way.
Yeah, I mean, this to me is the good news as a former breast cancer patient, one who's had reconstruction, who serves a community, and I'm listening to patients because often, Dr. Elkwood, they just don't know who to reach out to. And so providing this pathway to care that we spoke about today with the information, I think will be very valuable for them because
And,
they just don't know who to reach out to
and I
sometimes.
found in my experience, some of them actually feel guilty reaching out. If they're cured of their cancer, they feel like anything else is really a distant secondary concern.
Yeah.
Frankly, sometimes the medical community is like, you're cured of your cancer, that's a win, that's 10 out of 10. And tough it out with some of these other things. And not in a callous way, just in, hey, the goal was to cure the cancer. Some of these things develop long after the initial treatment, and you kind of fall out of that community and you're not necessarily put in the right direction. And again, a lot of these women feel like they're cured, get on with their life, but some of these things could be really troublesome, and some of these things are just very annoying.
Yeah.
And it really runs the spectrum. So I think the service that you're providing by getting this information out to people, communicating with them, being kind of a broad support group is wonderful,
Well,
because
thank
these
you.
women need to know these things are out there and they're not being silly or petty or whatever by trying to address some of these secondary issues, even if hopefully they are cured of cancer.
Right. Yeah, like I said, sometimes the pathway to a solution is to begin the conversation, and you've provided a good resource today. And so I really appreciate your time because making a decision to have surgery is never easy. We know that there can be long-term effects from that or from treatment. And so I've really enjoyed meeting you today, number one, and also having this conversation with you, Dr. Elkwood.
Sure. And I thank you for the public service really that you're providing. And just to comment on what you just said, it's not always the surgery, it's the other treatments sometimes that cause some of these things. And
Exactly.
chemotherapy unfortunately can have long-term
Radiation.
effects. Radiation certainly can
Mm,
have long-term effects. These are wonderful. I in no way, shape, or form would I want to dissuade anyone from pursuing these treatments if they're appropriate. But they're potent treatments, and potent treatments often have side effects. It's just the way medicine is.
yes.
But there's a lot of help to be had for
Yes.
these patients.
Yeah.
So again, I thank you for the public service you're providing. It's
Well,
great.
thank you for your time today. It means a lot to me.
You're very welcome.
All right.
Take
Take care,
care.
Dr. Elkwood.
Nice to meet you.
Uh-huh.
Bye-bye.
Bye.